I don't know. I mean, it's like what happened in the 6 months? Was he just training, almost like Anders Breivik style, just like training constantly to do this? Did he have a schizophrenic break? Was he sort of I mean, I joked about this on Twitter, like he was MK Ultra. What was he sort of taken in and brainwashed and fragmented to the point that he would do something like this?
I think the way he was clearing the jam from the gun in that moment of high stress really seemed like very, very well trained.
Another possibility might be he was just taking out his family competition in true Italian fashion.
Well, I'm not sure they were competing with the insurance. I mean, they were like getting money from the insurance. Maybe their family got screwed over and he did. Yeah, that's possible.
I mean, there's also like an element of wanting to be seen here, like the idea of having a backpack full of Monopoly money and trying to create this mystique as a sort of a Joker type or a Batman villain. I
Hmm.
mean, I mean, you could, I mean, I think comparing him to Breverick is a bit of a sort of an insult almost to Breverick because ultimately what he did really kind of changed politics in Norway, whereas I think this ultimately it was kind of a mediocre act. I mean, I'm not, it's terms of like going going off the rails and doing something. There's a lot more you could have done to
I
make a
think it's a
bigger
totally
impact.
mediocre act. And the look at the people who resonate with this, like if Taylor Lorenz is resonating with it ideologically, then you should check yourself. Where do I begin with this? There is this notion that I remember hearing 10 or so years ago when there was the Obamacare debate, and it was like, why doesn't everyone have insurance health? And I would always say, like, why do you want insurance? Like, insurance is not the fucking point. The idea is that everyone is healthy. And there are ways to get healthy that include nutrition and exercise and having reasonable medical facilities. And I would probably even throw in a kind of Plato point of we should be helping people who are injured or temporarily sick and not perpetuating people who are sickly or dying. But there's this fascination of like everyone needs health insurance. And it's this kind of American style socialism of we don't want to just give people food if they're hungry. We instead want to give them a card and like allow them to pretend like they have a debit card and have like the illusion of choice at the supermarket. So they're kind of one of us. Like we don't want to engage in actual socialism. We want to engage in like universal bourgeoisification. So it's like, why can't everyone have health insurance? Why do you want insurance? Insurance is like for merchants filling their ships with goods and spices and traveling across the Pacific or something. That's what insurance is about. You don't want insurance. We don't even use health insurance as insurance. Insurance is about something that is catastrophic and unpredictable and extremely rare. The fact is, you have to go to the hospital to get a checkup, get your eyes checked, go to the dentist, go to urgent care and get some antibiotics or whatever. It's something you use all the time. So what it really is a kind of you could say a tax or like a prepayment plan. Insurance at this point is a kind of middleman eking out some profit here and there, whereas the big problem is the provider. Yet we don't want to attack like hospitals and nurses.
Insurance is really a wealth redistribution scheme from the healthy that pay into the system to the sick that are the recipients, and a large and a very corrupt intermediary called the health insurance industry. I agree with you. It's a complete misnomer. There's no insurance here. It's really access to services. And
Mm-hmm.
interestingly, um, United Healthcare specifically owns a lot of medical practices and clinics. And it's nothing short. I'm astonished that the anti-monopoly regulators in the US have not zeroed in on this, because apparently under the fig leaf that so-called health insurance companies are buying companies in other sectors, such as medical practices and drugstore chains. Somehow this does not constitute monopolistic behavior. It certainly does, because you control every step in that food chain. You have doctors who are basically tied to dealing with particular insurers, and they create, if it's not a requirement, but they create very strong incentives to buy medications and medical supplies through distributors and drugstores that they own, that belong in the same organization. But the way this came to be apparently is because specifically, I mean, I can't remember where I saw it. There was somebody published a list of health insurers, like the top 15 health insurers in the US, ranked by the percentage of claims they deny.
United
And
Health was up
United
there.
Healthcare was on top. It was
Yeah.
like something like
30% or something.
36% or something like that. Yeah, it was the highest. So clearly, this guy may have researched it and zeroed in on the target, and their shareholder meeting was coming up, so this was convenient. But apparently the way the medical practices became part of that business empire is because of this denial rate. Basically, the medical practices find themselves unable to fund their working capital.
Mm-hmm.
And the same group, in the case of United Healthcare, owns a finance company. It's essentially a payday loan company that lends money to the medical practices that cannot pay their bills because the insurer is holding up the claim and not paying it, but they have to pay for supplies, they have to pay salaries to their employees and so forth. And before too long, a lot of those practices fall into the state of, pre-bankruptcy, and then United comes in and basically buys them on the cheap, and that's how they've been able to consolidate this empire. It's truly an evil business. And very
I'm becoming less
every
sympathetic towards Brian Thompson.
Well, yeah, he himself, I heard the only thing personally about him, and I don't know if it's true or not, but presumably he was instrumental in designing an AI-based system that questioned doctors' bills and basically automated, based on some AI algorithms, automated the process of denying those claims or reducing them to whatever United considers profitable to themselves. So yeah, if even that is
Maybe
true,
Luigi had gotten wind of something like that, because he does have a fascination with AI, and you could see in his mind the way you would depict that is like, oh, so it's some evil robot that's making life or death decisions. You die, oh, you get to live because you have enough money. Oh, your grandma dies, that baby like that. I could see him becoming morally righteous over reading about something like that.
Could be. Yeah, it's certainly in his wheelhouse. But even without, I mean, somebody early on, when he hadn't been caught yet, pointed out, and again, it doesn't seem to have been corroborated since then, but apparently, obviously, his own episode with his back pain, with his injury that he received as when surfing in Hawaii, apparently. And somebody suggested that a couple of his family members were mistreated badly by health insurers, even though you kind of wonder whether that's true or not, given that the family is pretty wealthy and could probably handle whatever challenges, financial challenges, could be. But certainly, yeah, it's pretty fascinating. Even the Wall Street Journal a couple of days ago had an article saying, well, the trouble with the manhunt at that time was the pretty serious amount of support that people expressed toward him, and there was numerous people going online and saying, well, condolences for the Thompson family require pre-approval or something like that. Some snide remarks
Yeah, I
that
saw a
were
lot of,
clearly,
yeah.
yeah.
I mean,
So
I would grant libertarians the benefit of the doubt here, like for in the sense of a free market out of pocket system might very well be hugely efficient. And if you think about it, like I even hate mentioning this because I kind of feel bad even thinking about this, but I had my dog Zeus neutered, castrated, that is, yikes. I remember taking him to surgery. It was done in one day, and it cost, I think it cost between $400 and $500. It really was not a big deal. And granted, he's a dog, but that is a major operation, something you don't want to screw up, something that's important and delicate to say the least. And it was a three-figure bill that I just paid with my debit card then and there. And if we had a free market in healthcare, that there would be all the incentive in the world for the clinics to make things more and more efficient and inexpensive. We forget, like I think the cost of like the original Apple Macintosh was like, I think it might have been 5,000 or something in 1984. Was that when it was, or 1982? Which is the equivalent of 15 or $20,000 computer now. I mean, the laptop I'm using, I can't remember exactly, but I think it was under 5 grand, and it's a nice MacBook Pro. So in it has a higher resolution screen, far more memory and storage, far more powerful, and it is less expensive, even nominally, but it's certainly less expensive with inflation. So everything with technology is pushing prices down, making things affordable. Even some homeless people have smartphones. That's a computer in your pocket. So why wouldn't this apply to the medical industry? I think this is, as much as we hate libertarians, I find it hard to disagree with them, actually.
I was gonna say that there's this hatred of Milton Friedman in our circles, and I have to say, I mean, first of all, let's not confound his academic research with his, societal prescriptions. Those are two different things. When it comes to his prescriptions, I mean, there's good and bad. There's good and bad, and but one of the things he did say was, deregulation. He was really a proponent of that, and even there, it's a case by case thing. But in the case of healthcare, I just kind of have to agree. I mean,
I know.
it's
Look,
very much a
we can
nightmare.
be grown ups enough. We don't have to buy into the philosophy of libertarianism just to say that they're right about this. Now, the problem is we don't live in this world, and we live in a moralizing world, as I said before. Like I remember the debates over Obamacare. I was actually living in New York City, and there was one person saying, like, can you believe that 30% of the country doesn't have health insurance? And I would always respond, why do you want health insurance? What about paying like $900 a month or whatever, $500 a month for some thing called like US Health United? Why do you want to do that? Why does that? Because the reason why they want to do it is that it's a status symbol. It's like you're rich or something. The goal is to be healthy. The goal is not to have health insurance. I don't know. I've already said this. I'm repeating myself. It's just always bothered me. So again, we're doing it wrong. We have this like middle class way of doing things where everyone is going to have universal insurance as opposed to universal health. Universal health would involve different things. It might very well involve regulating nutrition. It might very well involve, it does involve, this is one thing we're good at, it involves compulsory vaccination. It might very well involve compulsory exercise, but it's not about more insurance. We've obviously become obese. I mean, it's a correlation, not a causation, but under this system, we're obviously getting obese and dumb and slow and et cetera, et cetera, et cetera. We want health. We don't want health insurance. We also live in a kind of morally righteous time where, if someone can't afford a car, that's one thing. Or if someone can't afford a new Rolex, that's one thing. We're sort of okay with something that can be considered luxury not being universal. That's sort of the point of it, after all. We live in a world, I totally get this and I understand it, where we think all of this should be universal. If you're not granting someone the access to a hospital, you are in effect murdering them. And under this system, I think we need some sort of universal health coverage. I am a kind of compromising libertarian on this issue. So if I could just create a system that is right, I would do a sort of post office like solution. So there is a government run, not for profit clinic where if you are dead broke and you get into a car accident, you're going to make sure that your legs are healed and your broken leg is healed, and they'll do some tests on your brain to see if that concussion's too bad. There's a sort of baseline of government post office style healthcare that you're not going to die on our watch, basically. Now, on top of that, could you have health insurance or clinics as a sort of like elite thing, an almost luxury product? That's the compromise that I would come to. I'm just recognizing the fact that people are very morally righteous about this. But then I'm also recognizing the fact that the libertarians are right, and if the free market were allowed to apply to health providers, it would be a hell of a lot less expensive. There it is.
And I think the onus falls, and people don't like hearing this, but it honestly falls on doctors and hospitals, like the sort of backwardsness of the healthcare system, the costs. I mean, just sort of an example of this, I was reading about how there was a company that was trying to use AI image recognition to essentially diagnose based off of X-rays and CT scans, and they were blocked from receiving training data, not even by the hospitals, but by the American Association of Radiologists, or some other kind of lobbying group, because these doctors have this incentive to have some person that went to school for 8 years misdiagnose some ailment based off of an X-ray, rather than have the one thing that these neural nets are really good at, and that's like image recognition. And
we might have
and you
talked
see
about
that
this. Did we talk about this before? My maternal grandfather was a radiologist, and even when he was retired and well into his 70s and 80s even, the hospital would drop off like a dozen X-rays to him. And in the afternoon, probably while drinking a bourbon on the rocks, he would like diagnose people. I think he just did it. I'm sure he probably was paid to some degree. I think he just sort of wanted to kind of like keep a foot in the ball game kind of thing. But AI could do that. Like what he did, he was just going through X-ray. AI could do that, and he could read a book or something. Yeah.
there's this like perception of healthcare providers as being like this holy class of individual that is, completely self-righteous, and they're doing things for the good of the people, when in reality, most of the people who are becoming medical professionals are doing so because it's an easy way to get, quarter to $500,000 salary, for honestly work that is, I mean, unless you're some kind of intensive care, unless you're like a surgeon or you're doing some groundbreaking, stressful medical work, it is quite, I mean, I don't want to call it an easy job, but it's not really a job where you have to innovate.
Yeah.
You just kind of implement some
Yeah.
skills that you learn in medical school and training and residency. And I mean, iatrogenic deaths are it's the third leading cause of death in the United States. That is death caused by misdiagnosis, by I mean, I think that includes people getting infections from staying in hospitals, but there is a large percentage of people who die early because they are misdiagnosed by healthcare providers and are given the wrong medication or not the right medication, or they don't catch some ailment in time. And so I think, we need to stop, lionizing these healthcare care workers as being these totally selfless, scions of greatness or something.
Yeah, and to add to your point, first of all, it's more than money. It's also a cultural and artistic device to be a savior. I think there's a lot. I mean, even if you were to cut everyone's salaries in half, I think people would still regard being a physician as like the epitome of social clout,
Hmm.
precisely because they're kind of adhering to a breeding model, quite frankly.
Everyone respects doctors. I mean,
Yeah.
there's no doubt about it. It's funny. I come from many people in my family were doctors. My father is a doctor, and my maternal grandfather was a doctor as well. I never had an interest, and I always hated being in hospitals.
I think
I
there's
had
something
some Nietzschean gene of like something's falling, give it a push.
Yeah,
You know,
same here. I
you
have a
should
lot of
repair an injury, but if someone's inherently sick, he should die.
there's something like
That's Plato,
solace
not
and
Nietzsche,
and
but I agree with it. I've always agreed with that. I just had that kind of, I don't know.
yeah, I too had a lot of doctors in my family, and I don't know. I just couldn't. Initially I went into pre-med just to satisfy my
Hmm.
parents, basically, and
Hmm.
yeah, I was like, no, no way. I'm not
Yeah,
spending the next 15 years of my life doing this.
with sick people. Yeah, it's not for me. At the same time, I maybe this is a residual bias on my part, but um the conservative attack on vaccinations and doctors being evil or something that really rubbed me the wrong way. And maybe it is just a residual bias. It might very well be to some degree. It doesn't mean I'm wrong, but I just, you know, I don't know. I guess I respect doctors as well. I understand all of these criticisms though.
I think it's a
Yeah, but
soulless and it lacks creativity, and it's sort of the perfect place for a midwit to exist in, is being a healthcare provider. You don't have to innovate anything. You don't really have to creatively solve unless you're a plastic surgeon or doing some novel form of surgery or in
Hmm.
medical research. You're sort of just kind of following the rules. You're doing things by the book. You have to have a lot of book smarts. You have to be able to study and memorize things. I mean,
Hmm.
that's like the majority of medical school is just kind of you'll hear doctors talk about, well, at medical school, I just had to memorize a bunch of these terms that I'm not really using in day-to-day practice. And there's this sort of institution that I think is built up. I think I also read somewhere that one of the doctors associations actually, and these medical license boards, they lobby to reduce the number of spots in medical schools.
Yes.
And that kind of, if you think about it from a game theory or economic perspective, it's in these people's interests to reduce the supply of medical providers by introducing barriers to entry, to
Yes.
prevent people. For example, you have to get a 4-year degree that's sort of, I mean, I wouldn't say 4-year degrees are useless, but you're doing what, maybe a year's worth of pre-med courses to be able to get into medical school. That's itself an artificial barrier to entry. And then you have, medical schools that are extremely expensive that kind of put you in
residents,
this, yeah, you have a, 4 to 10 year long residency. It's this sort of very
cartel.
established, exactly. It's a very
Look, not everyone in society is going to be an innovator and is going to want to change the world, and that's okay. I mean, I agree that it is a sort of midwit or kind of upper midwit profession. At the same time, if you're performing surgery, I mean, my father performs eye surgery on the retina. I imagine that you get a godlike thrill from doing something like that as well.
Oh yeah,
Yeah,
there's
Um,
a high correlation between those types of professions, surgeons and psychopathy.
yeah,
Our medical community is it's a big redistribution scheme of taking money from the healthy and those that are fit for survival in a lot of ways to the people that are sick. And like I remember even seeing this during COVID. Like I'm in my early 30s. I never got COVID.
hmm
I would often flaunt it, not even wearing masks and stuff like that. And I never got COVID the entire time. And yet I was forced to do all these things when, of course, older people, sickly people, they should wear masks. They should get a vaccine. They should be prepared for this. But that should be their decision to choose to save themselves and not die from this. But they're forcing the healthy people to redistribute their time, their money in the healthcare system to the unhealthy. And it's just a lower class cult in a lot of ways.
Yeah, and it's exactly the reason this system that we have exists is because uh, it's at its core a redistribution of wealth from the young and healthy to the old and sickly. And the way out of it is could be one of the two. One is what Richard kind of touched about, which is eliminate health insurance altogether and basically make it retail, pay for the service at the time the
yeah,
service is provided. It is, it seems unfeasible at this point because of the amounts that we've seen, people being charged for medical procedures or for even, medical visits. But what's going to happen if that was the direction taken is throughout that industry, providers will be forced to adjust their cost structures to to the new reality where people can only pay within the limits of what they earn,
yeah,
and it would cause a mass dislocation in the industry. Then a lot of providers, a lot of companies, a lot of medical practices will go bankrupt. There'll be an enormous amount of savings because a lot of the corruption and waste will be cut, but over time, immediately the effect will be extremely disruptive, but at the end of the day, healthy. So the libertarian solution is not without merit. The other way to do it is to go to single payer and basically make it like, majority of the developed world handles it, perhaps dealing with the uh, like any public good, if it's socialized, it leads to some extent to shortages of services that are the most high value added. I
hmm
mean, you take any developed country and the benefit of having a socialized system in something like 85% of uh, diseases or conditions is obvious over the system that the US has because it's better positioned to do it because it's not expensive to treat those and it doesn't require um, an incredible amount of like VC money flowing into cutting edge research. It usually in most of those countries that system is supplemented with a private sector. Like for instance, if you don't want to wait 6 months for a hip replacement procedure, you can go to a private doctor if your budget allows that. Things of that nature. So you're not exactly stuck with the
hmm
socialized option. It's not a bad solution. Just one quick anecdote. I've got to jump, but I about a year ago I met an Indian doctor, a cardiologist who came to the U.S. something like 15 years ago. Started a practice, a fairly large, successful cardiology practice in Atlanta. And he told me he is about to throw in the towel and go back to India
mm,
because he cannot deal with the economic uncertainty anymore. And he gave me an example of a patient who came for a fairly simple and inexpensive procedure. And I can't remember the exact dollar amounts, but the word of magnitude or the kind of the proportion is about right. So that procedure, if he were to pay for it out of his pocket, was going to cost him something like $100. But he had insurance. And he said, why don't I use insurance? And insurance, it looked like, was going to pay for it. So you can never ascertain beforehand what amount of claim will be paid and what will be the out-of-pocket cost. And he says it turned out that when he used the insurance, his out-of-pocket cost was $500. It's with insurance versus $100 if he had to pay just out of his
Well,
pocket if he hadn't been insured
$100,
at
that
all.
sounds like he removed a wart or or
Yeah, yeah, it's
something.
something
Yeah,
very
like
basic, something
again,
very
if this were like a free market, that would be like 29.99.
yeah, yeah, exactly.
You
But
know,
even then, if you're facing retail customers, everyone adjusts their cost structure. Providers like you don't have grocery chain charging $500 for a box of cereal just
right,
because they know people cannot afford it. Otherwise, they would. If they had a third party paying for that box, they would certainly scratch their head and say, how do we charge a lot more than
Yeah.
reasonable? And it's the same thing applies here. So incentives are twisted. If you remove those incentives to gouge costs, to introduce waste, and to introduce corruption in this, at some point it will work out. In the meantime, for the foreseeable future, you'll have chaos in the industry, or you go to single payer, basically.
hmm
So
yeah, I almost think this thing has to just collapse. I mean, the fact that there's no real political will to overturn the current system. I mean, I don't know. Maybe Project 2025 has some secret plan. But Trump has basically said, we've got concepts of plans. I don't know. There's just so many things about the United States where it's like there's not the political will to fundamentally change the system. A real solution is visible and completely rationally defined, and yet we can't get there because it's going to dislocate billions of dollars and millions of people are going to be unhappy for a period of time. And we're just stuck. And it just keeps getting worse and worse. And people use the bankruptcy system to pay for medicine. I mean, it's just irrational and mindless. And we're not really putting strong incentives on people to get healthy. We should have like tax deductions on, I mean, because the insurance company do this, to give them some credit, but we should have like tax deductions on exercise or something. Like you should just write it off. Like you hiked 100 miles over the course of a year. Yeah, that's a $10,000 tax deduction because you are going by doing that you are going to cost society so much less than some fatso eating potato chips watching Netflix. It's not even a question. But we don't incentivize those things.